Hello everyone. Welcome to Dental and Beyond, a podcast by myself, Prof.Dr. Deepak Daryani. In this episode, we are going to talk about temporomandibular disorders or simply TMJ disorders. Now, TMJ disorders exist very commonly in the society. The common symptoms associated with TMJ disorder are clicking in the joint, restricted mouth opening, pain in the jaw, pain in the muscles of the jaws. But sometimes the TMJ disorder may present as eye pain, headache, neck pain, and back pain. Now, TMJ disorders or temporomandibular disorders are not very commonly understood or not clearly understood in the medical science, and often a lot of misdiagnoses and mistreatments are done. Patient keeps going from one doctor to other, one specialist to other, to an ophthalmologist, to an ENT specialist, to a neurologist, or to a dentist. So in this episode, we are going to talk about what are these temporomandibular disorders, what are the common signs and symptoms which we can associate with these disorders, what are the investigations, and what are the latest current evidence-based management which we can adopt to tackle these problems. In this episode, we also have a section of dental sleep medicine where we are going to talk in depth about snoring and obstructive sleep apnea. So let's go ahead and see this episode.
Dr. Deepak Daryani graduated from M.R. Ambedkar Dental College and Hospital, Bangalore in the year 2002. Post which he completed his post-graduation from A.B. Shetty Memorial Institute of Dental Sciences, Bangalore in 2007 in the field of oral medicine and radiology. He did certification courses from New York University in endodontics, full mouth rehabilitation, as well as aesthetic dentistry. He did also fellowship in orofacial pain, temporomandibular disorders, and dental sleep medicine from Roseman University, Utah, USA. Currently, he is the founder of HSR Dental Clinic and Implant Center, Bangalore. He established orofacial pain, temporomandibular disorders, and dental sleep medicine centers in Bangalore. There are 2 centers of this kind in Kerala as well as one in Doha at Green Health Dental. Currently, he is the professor and postgraduate guide in the Department of Oral Medicine and Radiology at Malabar Dental College and Research Center, Kerala. He served as the head of the department of the same department till the year 2023. He has been the resource person in talks, symposium and workshops nationally and internationally in the field of orofacial pain and temporomandibular disorders in particular and oral medicine in general. He has published multiple articles in reputed journals both nationally and internationally. As of today's date, Sir have 25 years of clinical experience and 18 years of academic experience in dentistry. You can get to know more about Sir and his accomplishments at www.drddeepakdaryani.com. Sir, please tell us a brief about HSR Dental Clinic and Implant Center, and one very interesting question that pops in my mind: why Bangalore out of all the cities in India?
So let me start from the beginning. I come from a small town called as Bhilai in Chhattisgarh. I was born and brought up there. It is an educational hub. And I did my schooling from Bhilai. I did my graduation and post-graduation in dentistry from Karnataka. The love of my life, Dr. Fiona, who's my wife now, is from Bangalore.
Okay.
And since I studied in Bangalore, I always loved the city, the climate and the people. So we decided, both of us, that we will settle down in Bangalore. That's how I came to Bangalore. But I didn't start from Bangalore. I started as a associate professor in the Department of Oral Medicine in a college in Chhattisgarh, and I was always interested in clinics. So I joined a clinic simultaneously. After working for 2.5 years, I shifted to Bangalore. Coming to establishing HSR Dental Clinic, I always wanted to have my own clinic because my philosophy about treating patients was changing. So I established this place here in HSR layout, hence the clinic's name is HSR Dental Clinic and Implant Center. I chose this spot because it was not at a very busy road. It was it's a residential colony, a lot of parking space, a lot of green space, which I like because I was thinking long term, so I wanted to settle down here. My core philosophy about treating the patients changed. When I worked in the dental colleges and in the other dental clinics, I realized that the dentists work unidirectionally. Like if a patient is coming with tooth pain and a doctor wants to do root canal, he thinks only about the root canal. He doesn't realize that he's a person as a whole. If he keeps opening his mouth for a long period of time, he may develop a muscle pain or a TM joint disorders. Like that, there are various examples. My current core philosophy of working, and I teach this to my students as well, that you have to consider patient as a whole. If he's a child, he has got certain other set of problem. If he's an elderly, he has got certain other set of problems. If he's a patient whose treatment is going to take a longer time, then we have to consider other factors, his systemic conditions, and then make an interdisciplinary approach to give patient a long-term predictable outcome. So this is my core philosophy as of today.
Sir, since we hear a lot these days about temporomandibular joint pains, and since you specialize in the same field, what's your take on such problems and how do you go about treating a patient with a temporomandibular joint pain or a disorder?
As you know, I specialize in the field of oral medicine and radiology, and diagnosis of temporomandibular joint related problems is a part of it. Okay. Early in my career in 2011, I realized that this is an enigmatic field. Not many people know about it. Now, usually this temporomandibular problems presents as orofacial pain in front of the ear, and the patient gets confused and they go to either an ENT specialist thinking that it's an ENT problem, where the ENT specialist will examine and say, no, there's no problem like that. But earlier in those days, even they didn't know about it. So they used to just say, go and get it checked by the dentist. Now, most of the dentists are also not having enough knowledge or not equipped with knowledge to diagnose. And the treatments like extraction of the third molars or a root canal treatment were done for such problem. I realized this very early in my career in 2011, and I decided to venture into this field and go more into the field. Since I was a PG guide, I started directing my PGs to do more and more research on it, and we did a lot of research along with the departments of prosthodontics and oral surgery. We did a lot of surgical interventions as well, and realized that the conservative management of temporomandibular disorders are the best way to go about it. We should not do any irreversible changes like surgeries or changing the occlusion, like putting the crowns or trimming the teeth for the purpose of TMDs. They can be done for other purposes, not for temporomandibular disorders. If you see the latest research by journal of which are published in Journal of American Dental Association, it clearly says that occlusion has got very less or no relevance with temporomandibular disorders. So the conservative management like pharmacotherapy, physiotherapy, occlusal splint therapy, exercises, and other things which can increase the strength of the patient or the physiological tolerance of the patient, like sleep management, posture management, cognitive behavioral therapy, nutritional management are the best way of managing temporomandibular disorders.
Sir, also sometimes we hear that occlusal splints are given as a treatment for temporomandibular joint disorders. So what do you have to tell us regarding the role of such splints in the treatment of the temporomandibular joint disorders?
Well, I think it's a very important question, the question about occlusal splints. So what are occlusal splints actually? See, occlusal splint is a prosthetic appliance. That means artificially made appliance which when worn creates orthopedic stability, means it relaxes the muscles. For example, if you are walking and you have sprained your ankle, so what will a doctor do? Either he'll put a cast or he will put a crepe bandage. What is the function of that crepe bandage? To establish the right anatomical position so that all the muscles are relaxed, so that muscles can take rest, and then later you can do physiotherapy on that and strengthen it. That something like that is an occlusal splint. However, what kind of splint you are giving is extremely important. For example, any splint which separates the teeth may help in relieving the pain. Now, if you give a splint which is an anterior positioning appliances, which keeps the jaw a little bit in front, and if the patient keep wearing it for more than 15-20 days, then one of the muscle which is called as lateral pterygoid muscle, which actually pushes the mandible in front, will be contracted for all the time.
Yes.
Because of the splint, it can undergo what is called as myotactic contracture, which is an irreversible change in the muscle. Splints are good, they help, but the function is only to relax the muscle, and hence giving a good splint is important as per me. There are literature which are telling that any splint is fine, but my experience and research says that when you are giving a splint, it should be taken in an orthopedically stable position. That means you have to record an interocclusal record. You have to record your upper jaw to lower jaw, maxilla to mandible record, where all the muscles are relaxed, and then give a splint, because any other kind of splint may harm the patient. Saying that, splint is not a magical thing that it will cure TMDs. It is just one of the palliative treatment which you give for a small period of time, and then you have to work on various other factors because of which the patient has succumbed to TMDs. Remember that when a patient has succumbed to temporomandibular joint disorder or temporomandibular disorders, he will be having multiple etiologies. So as a orofacial pain specialist, you have to find out all the problems which a patient is facing. May it be stress related problem, may it be posture related problem, may it be nutritional deficiencies, may it be systemic diseases, may it be occlusion related problem, if there are any, which is causing the patient to eat more from one side than the other. All these events has to be diagnosed and treated together to make the patient come out of this problem. So occlusal splint, in short, is, I told you what it is, should be given for a small period of time, and it is just a palliative treatment. It is not a curative treatment.
Okay. So sometimes we hear that change of occlusion or the change of teeth alignment is a proposed strategy for management of temporomandibular joint disorders. So it may be by orthodontic treatment, it may be by crowns. So whatever it is, what is your take, whether change of occlusion is required, or what is your take on the management strategies for temporomandibular disorders?
Well, I think, Dr. Rupanjan, it's a very good question. Why? Because if we understand this question, it will really benefit patients from a lot of the agony and trauma they go through. Let's look at evidence. There are a school of thought which says that changing the occlusion will manage TMDs. Okay, and people go about doing orthodontic correction, or they go about doing full mouth rehabs with root canals and crowns as the management of TMDs, one of the management of the TMDs. Let's look at the evidence. Let's look at the best evidence-based journal in the world today. I can name two: Dental Clinics of North America and Journal of American Dental Association. The latest researches mentioned in these journals says that occlusion has very limited or no role in the etiology of temporomandibular disorders. Most of the temporomandibular disorders are soft tissue disorders, not hard tissue. That means they are not bone related. Either they are disc related, which is a cartilage, or muscle related, which is more common. Now the muscle related problems are the most common problem with which patient will present to you with the pain. In other condition where it is disc related, there will be sound like clicking, but there won't be any pain, and we don't even have to bother about that. But if the patient is having pain and he's come to us, we have to manage. Now, occlusion is, so many people are walking around with malocclusion. If you check 10 people randomly, at least 5 to 6 will have malocclusion with them. Are they succumbing to TMDs? No. Then why occlusion is considered as one of the management strategies? So I completely disagree, and I'm talking from the evidence point of view. For that matter, any irreversible treatment modality should be avoided as the management of temporomandibular disorders.
Apart from jaw pain, can such temporomandibular disorders lead to ear pain, neck pain, back pain, or headache for the same?
Yes, again, a very important question. The most common symptoms with which patient will present with the TMJ pain is joint pain, decreased mouth opening, sometimes clicking in the joint, or deviation. That means jaw, when they are opening, it is going to one side or the other. One of the most common symptoms with which they don't present to a dentist is headache. So headache can be a part of temporomandibular disorders, even neck pain and back pain. Now, one of the most common problem when it comes to temporomandibular disorder is myofascial pain. It's not myofascial, it's myofascial. Fascia is the connective tissue with joints, muscle to muscle. So these pain can go from one muscle to other, resulting in referred points, not only in the jaw muscles, it can go to the temporalis, that is the muscle which is there in the head, which can cause headache, or neck pain, trapezius, which can cause back pain. So definitely neck pain, ear pain, headache, back pain can be a symptom of TMDs. Even the posture imbalance can be a symptom of TMDs.
So sir, are these temporomandibular joint disorders curable, and if yes, what is the best way or best management approach to treat such temporomandibular disorders?
To know whether TMDs is curable or not, we must know what TMDs is. So TMDs or temporomandibular disorder is one of the disease of masticatory system or chewing system. Okay. Now when you chew, you load the masticatory system. But there are certain other events also which loads the masticatory system, like eating imbalance, emotional stress, improper posture, improper sleep, cognitive dysfunction, chronic pain, nutritional deficiency, and certain systemic diseases. These are also certain events which loads the masticatory system. Now if the sum total of this load of chewing and the other events is less than the tolerance of the system, nothing happens. You will not come to me. But if the sum total of this normal function and event is more than the tolerance of that person, then he succumbs to TMDs and he comes to us. Right? Now we can manage TMDs because we know that when the patient has succumbed to TMDs, they will be having multiple etiologies. So we have to identify all the etiologies and treat it. If they are dental etiologies, we can correct it. Posture, we can correct it. But there are many other things also which are related to this. For example, weak muscles, cognitive dysfunction or emotional stress. So everything needs to be corrected. In long term, I will say that TMDs are manageable and not curable, because if the patient again succumb to certain other problems in their life, they may succumb to TMDs as well. So I'll say that by doing a holistic or multi-directional treatment modalities done together, we can manage TMDs. However, the long-term prognosis depends upon a lot of patient-related factors, but we can do a lot of education in this case to the patient so that they don't succumb to this problem.
So sir, according to your experience, how long a temporomandibular disorder therapy typically lasts?
Again, a good question. See, that depends upon patient to patient. Let me tell you one interesting fact. 90% of my patients with TMDs are ladies, and there's a reason for that. We know that the muscles of women are weaker than men because they contain more white muscle, whereas the men has got more red muscles which can store more oxygen. Also, the research says that the stress bearing capability of a woman is lesser than that of men, and that comes from the evolution itself. So the cognitive dysfunction we see more in females as compared to males. Now, how many events are involved in this TMDs will determine how long the therapy will last. Most of the patients are ladies and also they are of younger age group. Usually they are from 25 to I'll say 45, and most of them are young mothers where there are sudden changes in the environment which has led to this problem. Typically TMD therapy with me lasts for about a month. We do 4 weeks of treatment where I see the patient twice weekly, and we do a lot of multimodal therapies during this time to make the patient understand this problem, come out of it so that they don't succumb to this problem in future. We try to prevent the relapse of this disease as well.
So sir, please tell us a little bit about dental sleep medicine and what is the scope in current practice?
Well, I'll say that the knowledge of dental sleep medicine can be an adjunct to a dental practice, especially when it comes to two problems. First is the snoring. Definitely dental sleep medicine can help manage snoring, and the second will be it can help in management of obstructive sleep apnea, which is much more bigger disease.
So sir, at this point, can you please tell us a little bit about snoring? Can it be treated, or what needs to be done to treat snoring from our dental point of view?
So what is snoring? Let's go into that. Snoring is actually the simultaneous vibration of unsupported soft tissues of airway space, typically speaking. Now, is snoring harmful per se? I'll say snoring is very common. It may or may not be harmful. It has got its social implications. If a person is snoring loudly, there can be two issues. One is a social implication. The person's partner who's sleeping with him or her may not be able to sleep. There's a social implication to it. There's something called the sleep divorce, which has become very common, where the partners cannot sleep together and they have to shift their rooms. So that is one aspect of it, where a dentist can come in and help in giving appliances which can prevent snoring. Okay. The second thing is in the can we completely cure snoring? I don't think we can cure snoring, but we can manage it by using what is called as a mandibular advancement devices.
Also, one thing I heard about when you were speaking about is obstructive sleep apnea. So if you can just put some light on the concept of obstructive sleep apnea.
Well, obstructive sleep apnea is a bigger disorder, and one of the signs of obstructive sleep apnea is snoring.
Okay.
Now, it's very important that not all snoring cases are the cases of obstructive sleep apnea, but most of the obstructive sleep apnea cases will be the cases of snoring.
Okay.
Now, how will you find out whether a person is having an obstructive sleep apnea or not is the question. So the gold standard is only one, that is polysomnography. That is a sleep study. You have to visit your pulmonologist and they will do a sleep study and diagnose whether you are having an OSA or obstructive sleep apnea and what level of obstructive sleep apnea you have, and hence the management is decided. The gold standard of management of OSA is CPAP. Okay, and nothing can replace it. The gold standard is CPAP, but in the mild cases of OSA where patient is unable to wear CPAP because CPAP is a very uncomfortable appliance. It covers both the nose as well as the mouth, so it's not easy for patient to wear it for a long period of time. So in mild cases of OSA, we can give a mandibular advancement device and manage the mild to moderate cases of OSA.
So sir, can you please tell some clinical signs and symptoms of obstructive sleep apnea, and as a dentist, how we can understand that a patient is suffering from obstructive sleep apnea?
So about obstructive sleep apnea, it's a condition which happens due to when the patient is sleeping, the mandible falls back and the tongue falls back, obstructing the airway space. So basically what happens in obstructive sleep apnea is decreased oxygenation in the body, and the patient may gasp for the breath and get up. There are many signs and symptoms of OSA, like daytime sleepiness, forgetfulness, laziness, inability to concentrate, nocturia, even erectile dysfunction. These are the few of the symptoms which may be associated with OSA. There are questionnaires which we can use to find more about OSA, and how dentists can help is by seeing what is called as a Malampatti score. We can know how much is the soft tissue visible in the oral cavity and approximately determine whether this patient is a candidate for OSA or not. And if this is associated with some of the features, symptoms I talked about, if the patient is suffering, then we send the patient to the pulmonologist for a sleep study. And then the diagnosis is made, and then the dentist's role is to get associated with the pulmonologist and make a treatment plan. Especially when it's a case of mild OSA, or it's not a case of OSA, just a case of snoring and patient wants to get rid of it. Then dentist plays a big role here.